My name is Ginger Glory, and I am a registered nurse, but first and foremost, I am, the wife, the mother, and the grandmother of 9 grandchildren, beautiful grandchildren. Why is Medicaid important to me? Medicaid has made a difference in my family's lives. It means that we can focus on being a family. We can focus on important things together and not have to make some of those hard decisions of, how we're going to pay a bill or what have you. But more importantly, it's peace for me to know that when I'm long gone or not able to help anymore, if it ever happens, that they do have a resource so that they can have a healthy life. They have access to health care, and that's very important. But as a registered nurse, I can tell you it's crazy important. I don't want anyone to ever go without health care. That is I think it's a basic human need. I don't think anyone should ever be without it. Why should they have to give up health care? So that as a nurse, I'd have to say it's important because of that. Everyone deserves quality care. And they can't do that unless they have access.
My name is Heather Bridges, and I am a registered nurse. And Medicaid is important to me because everyone deserves, the best healthcare.
Absolutely.
They do have chronic conditions, stuff that they have to go every 6 months for like their heart conditions. And I think that just having that available to them and knowing that they can go and they can get preventative care and follow-up appointments and make sure that everything is still okay and we don't need to do any further treatment, that means a ton, because if something were to be bad or change in their status, then we can address that and we don't have to decide, okay, how are we going to pay for this next visit, or how is my daughter going to pay for it? Because she turns 19 in December, so that means before she wouldn't have had Sooner Care anymore, Medicaid. But now she went and she voted with me that day, and she voted to yes on that state question, and it was important to her because it means that she gets to take care of her health and she can go to college and she can focus on that and paying her basic needs, like her bills, her electric bill, the gas in her car, and not have to worry about a cardiology appointment. And so it just, for me, it means that they're taken care of even after I can't take care of them.
That was profound, that Madison, the 18-year-old, she was ready to vote. She had her card out. Yes, I get to make a difference for the state of Oklahoma, for our lives as well. And so huge victory. And we're so thankful. We're so thankful people made the right choice. One of the reasons that we're nurses is because, it's ingrained, I think, in the fiber of who we are, that we have to think about others, that it's not just about us. It can't just be, our lives can't just be about us. It needs to be more about others. It's about serving one another. And for me, this makes a level playing field, where the haves and the have-nots before, a lot of people have gone without the opportunity to be able to go to the doctor. Maybe, I'm thinking about my son. He works a part-time job and he supports 5 people, and he cannot afford even the smallest premium for healthcare. And so, why should anyone have to decide between paying that bill or how do I feed my family or what have you? And I just think that it's important that we continue to support things like State Question 802 and other initiatives to ensure that everyone that needs it and is eligible, has the opportunity for health care access. They need that access. It's important.
a lot of people have it in their head, like, this is going to raise our taxes and all these things are going to become, we're paying for people who don't work or they're not trying. I think that maybe they should also know that a lot of us out there, we're working and we're trying to better ourselves. And, whenever you're always like 6 feet under, it's like hard to dig your way out of that, especially when you're dealing with certain things like healthcare. I mean, who would think that you would ever have to do without a basic checkup or, medicine for strep throat if you get sick? I mean, just basic stuff, not even the heavy stuff like a heart condition, but, they do without those things. And it's not, and when you go without those things for years and years and years, you create huge, you know, deficits in the healthcare system because you're creating like chronic illnesses that could have been prevented. Like, and so it ends up costing them more. Where if we would have just paid for preventative care and checkups and screenings, then we could prevent a lot of these really costly procedures and things that would cost Oklahoma way more than if we just paid for basic care.
Well, and there's also a ripple effect in that. If you can't pay your house payment, say you have a mental illness or even a physical illness, you can't pay your house payment and your bills, where do you end up? Homeless? And, so there's even a more profound effect in this where, what about those rural hospitals, those doctors' offices? I mean, seriously, I don't know very many doctors that want to turn away anyone, but there is a financial impact in this. And so do we want to keep the doors open? Yes. Do we want to help some of our rural hospitals? Yes. It's just a domino effect. If you are sick and you have a chronic illness, how are you going to take care of your family? Change starts with us, and we have a responsibility as human beings to care for one another. And change, when I'm saying change in policy, change in how we live. And, now that this is passed, I think that we should be responsible and we should be good stewards. And that now that people, a lot of the uninsured that will be eligible to utilize the expansion, they need to do it. They need to get involved. They need to get involved in their own health care, make wise decisions, be good stewards. And then we need to support that, as just one another, one person to another, and value and respect one another.
I mean, I gladly will pay taxes every month and every paycheck so that other people can have,
absolutely,
healthcare. I would love to. I want everyone to go and have that opportunity. I don't want them to be faced with a hard decision and something that could have been easily prevented most of the time.
Yeah. It's so important to me to know that even the generations that I will never meet, the healthcare that my family receives today, it has a profound effect on those generations. And knowing that I may not always be here, and I need that peace of mind of knowing that my kids are going to be okay. And without being healthy, it really limits their life and their opportunities. And so it's about being healthy and doing the things that you want to do and not having to worry about your health, and maybe going to college, focus on that. You can take your focus onto something else. But as a grandmother, it's all about those future generations and knowing that they can get the care that they need.